A recent CDC report has found 1 in 9 children in the U.S. has been diagnosed with ADHD. This is a hike of 1 million more children than in 2016. Here to tell us more and why we are seeing this trend is Hartford Healthcare's Dr. Laura Saunders, director of the Center for Gender Health and clinical psychologist at the Institute of Living. Dr. Saunders, nice to see you.
Thank you, Ann.
All right. More and more kids, it seems, in the U.S. are being diagnosed with ADHD. Do we know why we are seeing this hike? Are we getting better at detecting it?
So that's a very good point. And yes, I think we are getting better at detecting it. And also, when this data was collected, it was part of the global pandemic. And we know that kids during that time had heightened stress, increased levels of depression and anxiety. So because more children were being evaluated, more children had their attentional issues picked up as well.
All right, explain exactly what ADHD is and how does it present itself in kids?
That's a good question because the acronym ADHD is tossed around a lot, but attention deficit hyperactivity disorder, or you don't have to have the hyperactivity component, but it's a disorder of impulse control, attention and concentration, motoric restlessness, as well as difficulties in emotion regulation.
All right, and so if somebody sees this in their child, what do they do about it?
I do think it's really important to get a proper diagnosis. Very often you start with your pediatrician or you talk to the school support personnel for your children in school because they really have a good baseline. School personnel have a really good baseline for if your kid's just a little bit restless or if they really seem to cross the line, and there's self-report measures that school support personnel can do as well.
All right, if you have a child with this condition, how do you help as a parent, as a sibling, as a guardian, grandparent?
I do think that diagnosis is really important because what I would hate is for these kids to be labeled as lazy or bad. And so I really don't want that to happen for them. It really just creates a lot of shame. So getting them evaluated also really helps with bringing in emotional and behavioral strategies. And for some percentage of these kids, medication relief as well.
All right, Dr. Saunders, thanks so much for being on with us today.
Take care, Ann.
You too.